I'm Allison Everett, and I'd like to, Father Robert Kennedy, who's a lay priest, we would like to stand up and give the invocation.
Stand up while we everything get that done. We can do it. We can do it.
Let us pray. Oh God, you impose on us the duty to work together to build up this world. Give us wisdom to develop the earth by the work of our hands and our minds. May our efforts bear fruit in making this world a home worthy of the whole human family. When we come together to affirm the cause of justice in the face of injustice, we're developing ourselves and perfecting creation. The work is hard. We need counsel and comfort. When things fall apart, when confronted with evil, co-workers' needs are great, when I'm tired, when work is not appreciated, may I find strength and the spirit to go on. When things are going well, when I'm seeing positive changes, when society is made better because of what I do, and I'm working effectively, when I'm honored and valuable as a worker, may I never forget to be grateful. May your loving kindness rest upon all workers. Keep them safe from harm and injustice. Provide the opportunities for all those who want to work, and for those who are presently employed, benefits and pay needed to sustain them and their loved ones. May we find clarity of thought, purpose, and direction in what we do here today as we focus our minds on the complexities of a changing healthcare system. We ask you to make our thoughts and words worthy of your name. Do not let us stray from the path of mercy and justice, but in all things, may we strive for the common good. Amen.
And Michael Monahan, Business Manager of Local 103.
Welcome to Local 103. I guess to open up the discussion here on the Affordable Care Act, Obamacare, as some like to refer to it as. I'm honored to follow the last speaker, my old priest, who retired, Father Kennedy, St. Monica's in South Boston. And, this is Local 103's training center, and there's a number of you that said you've never been in here, which was kind of a surprise to me. We've been this building's been over 20 years, I think. We still call it the new apprentice school, was we moved from Newton years ago. But it's a three-level training center with classroom and shops mainly on the other end. But feel free during any break if you'd like to just tour the building. For those building trades, I'm not sure I saw anybody from the building trades that are familiar with training centers in this sense. We just finished the building behind us that's going closest to the tracks, and I'll try and have that open. Impressive new training center that's more on-the-job type of training that we're proud of. Today, I guess it's going to mainly be the Affordable Care Act, which I think has been a good law, of course. There's many critics out there with it, and I find even within our own ranks, they're critical of the new law. Anytime more people get health care, I think is a good thing, especially when you're competing against an industry that doesn't have any health care for the most part, and that, as we do in construction. So all in all, I think it was a good law. Nothing's perfect, but we've been trying to aggressively talk good about it. We have an awful lot of conservative members in the building trades, unfortunately, and they don't even see how good it is for them. So it's a work in progress, but I think all of organized labor has to do a better job at talking about the benefits of that law and not focus on the negatives and let the Howie Cars and the rest control the media around that. So I'm not going to talk about it. There's others that are more of an expert at talking about that today. So welcome to Local 103, and if there's anything we can do to make the day go a little smoother, please reach out. You're going to be sitting there, but I'll be in and out like a lot of times, I'm sure, with phone calls and emails. So Thanks for letting me speak and open it up, Allison, and where the next speaker is. I'm sure we'll bring that on.
Steve
Thank you.
Tolbert.
Steve.
Thank you, Michael.
Could you imagine if everything you need to know about Obamacare in 7 slides? I think we've all... Good morning, everybody. But, and thank you to all the participants. Thank you to 103. Michael, thank you very much for your generosity again, as always, and certainly to the Labor Guild and your leadership, Allison. Thank you very much. As Michael said, we have to always try to find a positive in this Affordable Care Act. Unfortunately, the very basis of everything we know about in the trade union movement of healthcare, we're getting annihilated, and it seems like the Republicans just don't want to kind of cooperate and work with us, and that's what I always thought. And then the more you read, it's the Obama administration who gave us a promise that you would be able to keep what you have, you'd never be screwed, and it certainly has come out totally contrary to that. It's frustrating because we do know that in order to have progress, you have to try to find common ground, and that's what we're all here for. And I just really thank you, Allison. I wasn't able to stay the whole time last time, but I'm going to stay this time because it's just, in my opinion, probably the most important issue we're dealing with. We have a lot of good speakers. You don't need to hear from me. I say, let's get on with it. Thank you very much for all the participants, and it's great to be here.
Again, I'm Allison Every from the Labor Guild, and on behalf of our extended Labor Guild's family and our ACA Planning Committee, who are many of whom are here and terrific, it's delightful to see each and every one of you. Welcome. I'd also like to thank our wonderful hosts, IBW 103 and Mike Monahan, for their tremendous hospitality and kindness. I'd like to thank today's remarkable presenters and panelists. 2 of them flew in from Washington, D.C., and one drove this morning up from New Haven. And everyone who's pitched in to make today happen. For almost 70 years and 3 generations, the Labor Guild, a mission of the Archdiocese of Boston, has worked in real-world ways to support and connect this region's labor management community. We do that via our programs, education, and services. And one of our very favorite things to do is teaming up with great people like Steve and Mike and all of you to create safe, neutral spaces. Sometimes forums like this, where all the stakeholders in this complex labor management, economic, and human ecosystem can come together and frankly explore shared problems, issues, and ideas that often result in positive action. A successful first labor healthcare forum last year certainly kickstarted a much-needed conversation within the Massachusetts labor community regarding growing concerns about how ACA's design, evolving regs and implementation are affecting people on the ground now and in the near future. Today we've brought together a tremendous group of speakers operating in the healthcare bargaining trenches to update us on what's happening now and what's next. And I just want to give you a heads up. We have 3 PowerPoint presentations that are going to be launched today, and we will by next week have them on our website, along with some articles and materials that Peter has. And if you have any articles that you think are particularly well, we'll put them up too. If you scroll down that page, we have all our presentations from last year and a number of articles. And if you drill down even further, there are other things from government websites. Berkeley had put out some tremendous materials, and it's all on there for you. And so again, welcome and enjoy. And now let me introduce my good colleague, Rand Wilson, Communications Director of SCIU 888. Thanks.
Thank you, Allison. Believe it or not, we're right on time, and I guess Allison has asked me to work with the panel here to keep us on time. So welcome to the second meeting, and on behalf of the Planning Committee, really excited about this program. Everybody should have a program, and immediately after this opening panel, there'll be breakout groups, and you want to be sure and get into a group that's relevant to the union that you are a member of or work for. After those breakout sessions, we'll have report backs, and then reconvene here at noontime for kind of a sum up and more dialogue and discussion. I think we have 2 main objectives today that we were thinking we wanted to pull this together for a second time. One is immediate assistance and, if necessary, some condolences to help you deal with the challenges of Obamacare in bargaining and with union benefits. And so you will hear how people are approaching it. You can hear some solutions, get ideas. We hope to have a constructive dialogue around helping one another to face the challenges. It's embarrassing to admit it, but you know, the reform falls far short of what we needed. And as Mike and Steve mentioned, it has some positive elements, but it's hurting organized labor in really three specific ways that I think need to be addressed. The issue with the Taft-Hartley funds being blocked from competing for the law's subsidies, and setting fair regulations there, so that there's a level playing field for the Taft-Hartley plans. That's one challenge. The second is the incentive to shift more workers to part-time. That's inherent in the law. Employers said they wouldn't drop coverage, but hundreds, maybe even thousands of employers have cut workers' hours since 2012 to get below the 30-hour per week threshold for full-time work. And finally, third, there are incentives in the law for employers to push families and workers onto the exchanges to buy coverage for themselves, forcing in most cases, low-wage workers to spend $2, $3, $5 to buy comparable coverage that they would have previously gotten from their employer. So those are some of the weaknesses that we want to address and that merit dialogue and discussion. Secondly, second objective is, I think, to recognize that the problems with the ACA are fundamental to the employer mandate style of reform that they built into this law. Requiring everyone to purchase insurance from private companies or pay a fine, that is a model that's far removed from a system of genuine, universal health care in which progressive taxation, government-administered, single-payer insurance plan, Medicare for all. So we hope today to weave together an understanding within our ranks that the solutions to the problems that we face, whether it's through the Taft-Hartleys or with the shift to part-time, are not going to be solved by tinkering around with Obamacare. Ultimately, we need to move towards a Medicare for all approach. So I hope that we leave here today recognizing that instead of having trillions of dollars of subsidies for private insurance companies, that money is ours, and it should go for the public good, not private profits. So, we're right on time. I'm going to turn it over to our panel. There is some biographical information about each of our speakers, so I'm not going to belabor that a great deal. I think we're going to go in the order that is in the list, and so it's. And are we seated that way?
Yeah, we are.
Yeah, wow, well, that's fantastic.
Allison organized it.
How about Allison?
I'm falling into parochial schools.
All right, so David, introduce yourself and let's kick it off.
Okay.